Hi, welcome to Lab Rat Sherry. Today, let's talk about some common food and drinks that can affect your urine dipstick test result. Most people do a really good job on filling out the blank that asking what medications and supplements you are taking recently on their patient intake forms. However, a lot of people doesn't really pay much attention of their daily diets or snacks. But do you know, as minimum as 2 golden kiwi can actually already start to place an effect on your urine dipstick test result? Yes, you hear me right. 2 golden kiwi. Now, golden kiwi is one of the fruit that contains highest amount of vitamin C in there. In fact, 1 golden kiwi could already have over 100 milligrams, and 2 of them can easily exceeding 250 milligrams, and that is enough to potentially show an effect. So what happens over here is vitamin C is such a strong reducing agent, it can mess with a lot of chemistry reaction process. On a urine dipstick, tests such as blood, nitrite, bilirubin, and leukocytesterase are all the tests rely on oxidation to show a result. So if you have vitamin C in your urine, it can potentially give a false negatives. And why is this important? If you got a UTI, masking the result for blood, nitrates, and leukocytesterase can make your provider confused a little bit. And not just golden kiwi, if you actually go take a look of the nutrition label on a lot of immune boost shots, detox drinks, juice blends, they might all have really high vitamin C content. And ladies, if you are taking collagen supplements for cosmetical purposes, check the label. You might find a high dosage vitamin C in there too. Next, let's talk about vitamin B. Well, vitamin B is a common additive for a lot of energy drinks and sports drinks, especially vitamin B2. A high dosage of vitamin B2 intake can make your urine into a bright yellow neon color. While most of the time the sports drinks or energy drinks won't put in that high dosage, but if you're taking multiple of them or taking all kinds of different things or some multivitamins that specialize as boosting your energy, you need to be careful. While it doesn't actually affect the chemical process, but the color interference could cause a rejection on your entire test, because on each urine dipstick, there will be a pad for color control. If the color interference in the urine is too heavy and fail this control, the whole entire urine test will be rejected. And speaks of the color interference, we can't miss the beets and red dragon fruit. Both of them can make your urine turn into pink. If you eat too much of them, we can't accept your urine for testing, because all the result reading on urine dipsticks are relying on color changes. If your urine is pink, we can't read any of your result accurately. And last, for the gym bros, if you go to gym frequently and taking protein shakes on a prolonged period time in a very high dosage, yes, I know it is important for your muscle building and it has become part of your everyday diet. You don't even think about it when you fill out your patient intake form, but promise me, you need to fill this in, because some people would have proteinuria from the high protein diet, and your doctor need to know that. A proteinuria may not reflect a kidney damage, but they need to know this piece of information before they start the evaluation. Everything I mentioned above, most of them can be clear out your system within 24 hours of stopping injections, so don't worry about it too much. But do take a look of the nutrition labels if you are able to next time before you visit your doctors. Thank you for watching. This is Lab Rat Sherry. I'll see you in the next episode.